Hi, I'm Mike Dilk and you're listening to the Relax Back UK show, the show that explores all kinds of health topics relevant to you, your family and your friends. Each week I talk to expert guests from a range of backgrounds to inform and entertain you. So please do join the Relax Back UK family and stay tuned.
Hi, and thanks for joining me on the Relax Back UK show. This week I discuss a new cancer test.
And what we've set out to do is to be able to design and develop a simple blood test which allows testicular cancer to be pinpointed early and quickly without a lot of huge amount of fuss.
The guests are Professor Sir Chris Evans, CEO of EXD Medical, also Andreas Antona, a Michelin star chef who has had testicular cancer. Then something very different. Vet Dr. Anna Fawn tells us about the things that might be poisonous to our pets, particularly about dogs and chocolate.
And for pets in certain quantities, theobromine can cause toxicity.
So please do stay tuned for a great show. Thank you.
This show is cool!
My first question to Professor Sir Christopher Evans was just how common is testicular cancer?
Yeah, it's not very common. It affects young men, young men between the age of 15 and 45. About 2,500, maybe a few more per annum in the UK get testicular cancer. The treatment for testicular cancer is that there's various treatments, surgery, radiology, chemotherapy, etc., are very good. So a lot of those young men live a long life and have a good life. The cancer does have a habit of coming back, right? There's a recurrence of testicular cancer. And of course, if you catch it early, it's great. Then you stand a fantastic chance of having no side problems going through your life. If you catch it late and it's metastasized, then that is a serious problem. So that's the aim of everything we're doing, is to be able to test individuals.
Yeah. That was going to be my next question. Is it treatable? But the answer seems to be absolutely yes if you get it early.
Yeah, and the problem you got with these things, right, is that, particularly, and Andreas knows better than I do, with a lot of young men in particular, boys, teens, early 20s, there's a bit of a stigma about testicular cancer. They don't want to, they have aches and pains and all sorts of throbbing and maybe lumps down there. They want it to go away. They try to connect it to sports injuries and other injuries they've had, rock climbing or do whatever they do in rugby, etc. And they don't really want to go to the GP, and they don't tell their mum or dad. They don't tell anybody, and etc. etc. And that's how it progresses. And what we've set out to do is to be able to design and develop a simple blood test which allows testicular cancer to be pinpointed early and quickly without a lot of huge amount of fuss. And we've succeeded.
Chris, we will come on to some details about that. Let's see if we can swap into Andreas with a personal experience. How was your cancer found?
Well, I mean, I was unusual in that I was 55 when I was diagnosed with testicular cancer. So I was a little bit not in the norm, but it was a shock that there's a stigma around it, and it's a bit of a dirty thing. You don't want to be associated with it. So you have to get over that trauma. But the reality.
So did you find a lump and go to the doctor and say, look, this is a bit weird. What's going on?
What I did, I found a little lump on the other side, on my right-hand side, and I went eventually, most probably 9 months too late. And then I went along, and he said, no, that's perfectly okay. It's a cyst, which is quite common in men of your age, but I'll have a look on the other side. And he went, whoops, there's a problem here. I'll have to call your GP. And then 45 minutes later, the GP was on the line saying I had testicular cancer. So that was how I found out. But
the thing, I mean, young men, they're kind of, and older men really, we're always kind of adjusting ourselves, checking ourselves out. So are we not going to find a sort of small lump or anomaly?
Well, yeah, but you put it to one side. I mean, there were other signs that I found out since that were part of the symptoms, which I had been ignoring, like falling asleep, a cough, a hiccupy type of cough, which is normal with testicular cancer. And I'd been ignoring that, thinking, oh, yeah, I'm tired. So I think that the tests that have been developed is just to accelerate it, and it makes it a lot easier to discover what you have got in a very easy fashion.
Yeah. Okay. So we all need to be a bit more tuned in, and we need a more sensitive test, which is where Chris comes back in. You've got something to help us guys that might not be as aware as we should be.
Yeah, it's not only to help you. I mean, ultimately, it's going to help you and your GP and even the oncologist, the consultant clinician, all at the same time, because it's a simple blood draw that can be done by a nurse. It can be done in your house. It can be done in an NHS centre, anywhere you want to go. And that is put in a box, sent to our laboratories in Cambridge. We run the test. Our test is over 90% accurate in picking out very, very early stage testicular cancer. In fact, is 99% accurate at picking out the later stage testicular cancer. And that's really important because it's able to quickly tell the GP you have cancer, or 99% you don't have cancer. And that's what you want to know without, and you can do this quite quietly between you and the GP without lots of physical examinations. If you're shy and you're uncomfortable with that, you don't need to tell anyone else, but that result will be known relatively quickly. And then if you do have cancer, you would move on to the consultant who would deal with you. But the second part of this, which is important, is that you have to be monitored after you've had successful cancer treatment, okay, for testicular cancer, to see, number one, have you cleared it all up? Has it all gone? And that secondly, it doesn't come back in 6 months or 1 year or 2 years. And that monitoring, the current tests they use are about 45% accurate. Our test, believe it or not, is almost 99.9% accurate, almost 100%. It'll pick up any recurrent or leftover cancer present. So,
this test, it's not an at-home test where you put a couple of drops of blood in a little plastic thing and send it off. It's a bit more involved than that.
Yeah, the science is more involved, right? The science in the test, it utilizes 4 biomarkers. One is what's called a microRNA biomarker, which is world patented. It's totally unique, totally clinically validated, hence 99 to 100% clinically correlated with testicular cancer. And then 3, the other protein markers we use are already part of the NHS testicular pathway, okay? So we cover everything in this one kit. And the important thing is the blood draw, which is a blood draw, which only takes literally 1 minute, 60 seconds of a nurse pulling the blood out, that's sent to a lab and processed. So once it's done, you just walk away, right? You're done. And it's not a big deal, but it is a sophisticated bundle of science which has been optimized by us to run very quickly, very easily, and the results are extremely
Chris, can we delve into this sophisticated bundle of science a little bit more? You've touched on it a bit, and bear in mind that I'm not a medical person, and I think most of the listeners are just regular people.
Yes.
You're looking for, you call them biomarkers. Can you tell us a little bit more what you're looking for in the blood that when you take it out?
Yeah, well, when you take a blood sample for any cancer, if that's what you're doing, you're always looking for markers that are associated somehow or other with the cancer, okay? With early stage cancer, they could be DNA markers, they could be RNA markers, nucleic acid markers, protein markers, enzyme markers. So we call them biomarkers. They're all biological substances which exist in your cells, in your body. And when you've got cancer, of course, they've mutated, okay? It's changed. So some of these biological markers, as we call them, shouldn't be there at all, or should be at a pretty low level, shouldn't be at high levels, shouldn't be in certain ratios or combinations, starts to get a bit sophisticated. So, for example, this test we're just talking about, we've designed an algorithm Okay, so the data, the different readings of you or Andreas or myself would go into our algorithm, which then is able to produce what we call the sensitivity result. The sensitivity is the ultimate accuracy of a diagnostic test. So an 100% sensitivity means you've got it 100% right, and you can say it's there or it's not there. And we also generate other data. I won't go into it now. It starts to get a bit complicated about the type of cancer, et cetera, et cetera. But the important point is picking up the stages of cancer. This is what this is all about. And to detect very early stage cancer, those biomarker levels are usually pretty low, okay, in a blood sample. So you need an extremely sensitive test to be able to pick these out and put them through the algorithm, process them, compute them, and produce the sensitivity result. And a result of 90% is obviously very, very good to have. 50% obviously means you're 50% wrong, okay? And you're 50% right.
Time you're wrong, yeah.
Yeah, exactly. Once 90%, you're right up there. 99%, fantastic. So we have this range of percentages from 90 to about 100%, depending on the patient, their stage, their cancer, etc. Test is extremely reliable. It's been through over 30 different clinical studies, be through thousands and thousands of testicular cancer patients and obviously non-testicular patients as controls. And that's how it's all been what's called clinically validated. And it's been proved.
So these biomarkers are circulating in your blood, and they might be from the DNA from the, I don't know, maybe the tumor cells that have disintegrated, because they will eventually, that kind of thing.
Yes.
So you can pick up on cancer, but how do you know that it's testicular cancer as opposed to some other sort of cancer?
You picked. It's a good question, because there are in all cancers you have common markers. Okay, so there are biomarkers which will pop up in multiple cancers, and that's what we call a side result, in the sense that even the level of some of those shouldn't really be there, and it's indicative that you may have cancer in one or two other areas. But there's often biomarkers which are totally and utterly associated with one type of cancer, and they're the ones we're interested in. Very, very specific association with that particular cancer, which we have got in this test for testicular. In other words,
so you found them.
Yeah, we wouldn't look for those biomarkers in prostate cancer or ovarian cancer, because they're not relevant.
Yeah, okay. And the amounts of the different biomarkers, can you just tell us briefly about the research that kind of led to this? Because I can imagine it getting very complicated very quickly, and you're looking at differences over lots of different tests on different people. You're looking at different proteins, different DNA, and the amounts go up and down, and you've got to kind of make sense of this massive information to come up with a test that actually works.
Yeah. I mean, without, I'm just conscious of time, that in terms of all the studies, and obviously thousands of men, etc., you're taking the one blood sample, okay? So you take that sample and you're analyzing it, and we have what we call the test design, the equipment design, the full process setup that is able to analyze at incredibly low levels these biomarkers extremely accurately and consistently every single time. So it doesn't matter the age of the patient, or the shape of the patient, or whatever. We just want the blood sample, and then we dig deep in to pull these biomarkers out and look at their levels, where they are. Then the algorithm, which of course is a patented clever piece of software, does the processing, looking at the individual units, the quantity of them, the ratios between them, etc., and how all that is clinically associated with the individual stages of cancer, stage 1, 2, 3, 4, etc. It gets more and more easier to detect things on stage 4, sadly, but when it becomes metastatic and it's spreading, then you've got other biomarkers popping up all over the place because of the metastases.
Okay. I know you're short on time, but I'm going to ask you another question, because this stuff is interesting, and it's probably an unfair question. I'll ask it anyway.
Yeah.
I know in some cancers, say breast cancer, the ethnicity of the person makes a difference in how the cancer presents itself and
Yes.
also how you might treat it. Is the
Yes.
same true for testicular cancer?
Interestingly, yeah, it's a good question, because if you take, for example,
I do
prostate
love it when my guests say that's a good question. I feel like I'm doing something right.
Yeah.
So thanks.
Yeah, well,
That's
I'm
good.
assuming that you're not that brainy. You've just thought about the question before you asked it. But there we go. It's sort of
I'm not brainy.
What's actually happening here. If you look at prostate cancer, for example, in black men, there's a 50% greater chance of prostate cancer, and particularly aggressive prostate cancer, in those ethnic men versus white men. And there's a range of genetic reasons for that, hereditary and non-hereditary, genetic, biological reasons, which I won't go into now. And that occurs also in other cancers. In testicular, interestingly enough, the ethnic population gets away with it, because testicular cancer is quite unusual. I think is quite rare in the 15 to 45-year-old population of black boys and black men versus white boys, white men. And no one has really studied or pinpointed the real genetic reasons for that. And myself and my team, we're pretty expert in all of the cancer areas that we spend many years studying and looking into. I've got hunches of why that is from the genetic research that I've looked at and read about, but no one has clinically proven why that is the case. That they should be so protected from testicular cancer, yet the opposite on prostate cancer, the complete opposite, which is unusual. So, good question.
But your test works on everyone.
Yeah, ours works on all of them, and there's no particular phenotype, as we would call it, and you do see that in a lot of cancers, right? In bowel cancer, where people are very large or very overweight or pre-diabetic or diabetic and large and overweight and don't exercise and eat a lot of fat and a lot of sugar, a lot of saturates, a lot of processed food, and all of those things can input on their risk and status of their cancer and the progression of the cancer. And that occurs in a number of cancers, and it affects them all in different ways. And in testicular, living obviously a healthy, active lifestyle, and most young men are active. You may become less active as you get older. Andreas is a very fit guy. I mean, he's a chef. God, he's on his feet, 23 hours a day.
Yeah, he's got to be fit to throw knives at people.
Exactly.
That's what chefs do, isn't it, Andreas?
He's unusual. In his 50s is a very unusual situation to get it. And he's different in that respect. But
let's bring Andreas back into the discussion. So, I mean, should people get this test before they have any symptoms? Because if it can discover things really early on, maybe you can find out you might have it before that you can feel any lumps or bumps or feel anything different.
Yeah, absolutely. It should be done once a year, just for that peace of mind, just to know, because I think that's what lacks in young men or in cancer generally. I think there's tests here, and this one in particular is very easy to do and it works. So it just gives you peace of mind. From my test back then, they discovered at the same time I had kidney cancer. So it became more and more complicated. But I think for young men in today's society, I recommend that they should be doing it, once a year. So just to have that peace of mind.
Is that kind of facility available on the NHS at the moment? Can you rock up to your GP and say, look, I think I need a test for testicular cancer, and they'll do one?
Well, yeah, the way it's going to be is that once we launch this in the next several weeks and put it out there, it'll be on an online platform to start with. It's available to everybody, and it'll be available across Europe, not just the UK. So it's available to everybody, whether you're private and you're very wealthy or you're not, and you're part of the NHS. If you've got issues and you've got concerns, you go to see your GP, and he can buy it straight away if he chooses to use part of his budget to buy the test and get the answer straight away. He can do it. The NHS can make its own decisions, and different trusts will purchase it. Others may not. Privately, of course, you could just buy it yourself. You purchase the test, have the bloods done, and the GP will get the result. We don't send the result to the person, okay? It goes to the GP in every single case. It's important that GPs control the outcomes of all of these things and decide on the next stage, not you. But you can take the initiative and just obtain it and then go and have the bloods done.
How much is it? If I wanted to go and get this test tomorrow, how much am I going to have to lay out?
Well, it'll be hundreds of pounds. We haven't fixed the final price yet. It'd be less than £500, and it'll be, it's sophisticated. It's got a lot of complex stuff, machinery going on in here, but it's it's not thousands of pounds. It's less, as I say, less than £500, and it'll be put out there, available to anybody who wants to get it. And I know, for example, 2 GPs who are NHS GPs I was speaking to yesterday, and they said, we will definitely be purchasing it, and we'll probably keep 1 or 2 kits in stock. Should, young man come in, blah, 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 we'll immediately draw the blood and immediately use the kits. So that's nice to hear. But it's ultimately, that's up to the NHS. I know for a fact when I canvassed over 50 of the private GPs in London, every single one said it was a no-brainer. We would do exactly what Andreas just said, and we would advocate that any boys or young men or older men, by the way, with any concerns about the aches, pains, throbbings, lumps, etc., they would advocate using such a test because of its high accuracy. So you're not messing around. You're not leaving any doubt either direction. So that's the important thing. That's really what you're paying for here. So for me, testing really is all about high accuracy, great science turning into high accuracy, make it easy. The money thing is secondary. I know it's got to be affordable, right? So, we're not stupid, but, these things have got to establish a volume of their own in society. And this will, I think it will. And it's, it's going to be available. So there's no real excuses not to be able to access it. Anyone can access it once it goes out. And that'll go for quite a number of our cancer tests that we will launch, in over the next few years. And we'll be bringing out, obviously, what we consider the world's #1 prostate cancer test next year, which will be is dramatically brilliant, in my opinion. And so
I will invite you back on then, because I would love to know about that. Time will tell about how the NHS takes to this particular test.
Yep.
But right now, if people want to know more, or they're worried?
Well, you either take the responsibility yourself, which is what I did, or really you go to your GP. But I think with this being available, it makes life a lot easier. And it hasn't been available, and it should be, in my view, a no-brainer that this should be done on a regular basis, or at least if you've got an issue, you've got a lump, you've got a problem, you're not feeling too well in that area, then it's a no-brainer. Go and use your own initiative. Go and see your GP.
Is there good information on the NHS website? There often is.
Yeah, there'll be. I mean, on the NHS and other websites, there'll be information on testicular cancer and advice to go and see your GP. I mean, that's always the best advice. Go and see your GP, get checked out, okay? Then the GP takes the initiative thereafter. What Andreas is saying here, you can take an initiative yourself. You can tell your GP, I really would like this test done, and if he doesn't want to buy it, you buy it, right? Whatever. But they won't oppose that. It's a case of getting the accurate result, the accurate data into your file quickly for peace of mind, as Andreas mentioned, or it's confirmatory, and it confirms the issue is a cancer issue, and they now need to get on with it so that we can. The faster you deal with it, the better the result going forward. We, of course, will increase the awareness ourselves through publicity. EDX Medical itself will do that, and that'll be constantly increasing. There's also a cancer charity, which both myself and Andreas are involved in, called the Cancer Awareness Trust. and they're building the cancer platform, which is a unique, brilliant platform for free, for obviously for everyone to access, and all cancers and all information and awareness for all types of cancer will be on that platform. So testicular will have its section, and anybody could just type it in, go in there and find out their way along the testicular cancer journey. And there'll be all sorts of wonderful tests and treatments and remedies and dietary tips, supplements, exercise, whatever, in all of those sections. So that'll be available as well in due course next year.
Okay, right. People can look out for that. But for right now, thank you very much to both of you for taking the time to chat.
Yeah, that's great. I must run. Absolute
Thank you.
pleasure.
My first question to vet Dr. Anna Foreman was, are all vets doctors?
No, all vets are called doctors now. It was changed, must have been about 10 years ago now, so that our title was doctor, which is nice, I suppose. You know, we go through a lot of training, so it's nice to be recognised. It's a doctorate as well. But yeah, as soon as you qualify, all vets are known as doctors, which is nice.
And it is a lot of training, because I often think, okay, so for a medical doctor, an MD dealing with people, they've just got to learn about one sort of body, you know, ours, the human body. You've got to learn about them all, haven't you?
We do indeed, yes. So, you know, when I was training, as well as learning about cats and dogs, which is what I now practice in, you know, when I qualified, I was qualified and still am to treat cows, sheep, horses, you know, zoo animals, every type of animal really. So it's a lot of knowledge, especially with the final exams, to have to put into words for your degree. So yeah, no, it was.
How long did it take to become a fully qualified vet, Anna?
So 5 or 6 years, depending on which university you go to. I trained at the Royal Veterinary College, so our degree course was 5 years, with the last 3 years being more clinical based and the first 2 years being more preclinical based, so a lot of the theory behind everything.
All right, good. All right, so very qualified. So thank you for taking the time to chat to me today. And we're hoping to talk about, well, pets keep us happy. And dog ownership is very positive. So it seems like we've got a responsibility to keep them happy and healthy. And
absolutely.
In particular, want to talk about chocolate. Is chocolate really bad for dogs, and why?
Yeah, so obviously, you know, humans love chocolate. It's something that most households will have in their cupboards, but it is considered toxic to our pets. And that's because it contains a stimulant called theobromine, which is also found in coffee and caffeine. You know, it's what gives us that little bit of a buzz when we have chocolate or coffee. And for pets in certain quantities, theobromine can cause toxicity. So, you know, early signs include vomiting and diarrhea. And, you know, in large doses, you can see collapse. Dogs can have seizures. And some pets have even died from chocolate ingestion if they've eaten enough, and veterinary treatment was not sought at the time.
Okay. I mean, I have seen dog owners go into sort of an absolute panic if a dog eats, you know, you're eating a chocolate biscuit or something and a crumb falls on the floor and the dog snaffles it up, because that's what dogs do.
Yeah.
They're kind of, and I can't help thinking, you know, this is a bit over the top. And actually, before our chat, I did a little bit of Googling, which I do understand is a very dangerous thing. And I put in something like, you know, is chocolate really bad for dogs? And the AI overview came up and said, you know, if you've got a 10-kilogram dog, which is kind of quite a little dog. I've got a dog and she's probably about that sort of weight. The kind of amounts you got to worry about, 500 grams of milk chocolate or 150 grams of dark chocolate. So let's just, you know, 500, that's over a pound of chocolate. I mean, that is a massive slab of chocolate. I bought yesterday, I bought the biggest piece of chocolate, slab of chocolate I thought it's possible to buy, and that was 360 grams, you know.
Yes, yeah. So
it
is a
amount
lot
of chocolate to get ill, hasn't it?
Yeah. So yeah, I think with dogs, it very much depends on the type of chocolate eaten and the size of the animals. So Smaller animals can develop a toxicity from eating a much smaller amount of chocolate. So in our population, we might have Chihuahuas or Yorkshire Terriers who only weigh a couple of kilograms, ranging up to our, Great Danes and Bernards who weigh 60 kilo plus. It also depends on the type of chocolate eaten. So dark chocolate has much more theobromine in per gram than milk chocolate. So dogs don't need to eat, and cats and rabbits, obviously, they don't need to eat as much of it to cause a toxicity. Interestingly, white chocolate doesn't actually contain theobromine. It doesn't have that toxic component. But the problem with it is that it has a very high level of fat in it. If dogs ingest high levels of fat, it can cause a condition called pancreatitis, which is inflammation of the organ of digestion. A condition that can be quite horrible, actually. I've seen pets hospitalized for over a week for the condition. It causes vomiting, abdominal pain, like a very, very bad tummy upset. Even white chocolate has its downsides.
Well, yeah, I mean, white chocolate is not exactly a health food, is it, for any form of living being, I would imagine, dogs or people,
No, absolutely
for that matter.
Not. No, absolutely not. It's very tasty, though.
So for an average dog, say we're going back to our 10-kilogram dog, I've got a Bedlington Whippet. She's probably about that sort of weight. How much white chocolate then would a dog have to eat? I imagine it's a lot. Have you got any idea?
It is a fair bit. I think probably obviously, like I said, it causes pancreatitis more so than anything else. And I think it very much depends on the animal,
much?
really.
500 grams?
There's
that's a pound of white chocolate. No one's going to give that to a dog, or you're very unlucky if a dog finds it.
No, there's no set figure with white chocolate because there's no theobromine in it. But like I said, if you have a dog that is prone to pancreatitis, regardless, those are the sorts of dogs you want to be careful with white chocolate.
I suppose what I'm getting at is, you've got to be careful. But, if you are eating a chocolate digestive biscuit and half of it falls on the floor and your dog eats it before you get to it, you don't have to go into a blind panic, do you?
No. I mean, the best thing I can say is ring your vet, because what they'll be able to do is put the amount through the sort of chocolate calculator that we use. It's one that vets now have developed, who is sort of an emergency vets around the country. And we'll be able to see what the expected toxicity is, whether that be no toxicity, mild signs or severe signs. And I think in most of those cases where a dog has eaten half a digestive biscuit with a bit of chocolate on top, actually they should be fine. So I think,
I think you can probably say in every case, can't you? Really?
Well, I suppose it depends with a cat, a very small cat, a kitten, for example. If they eat half a chocolate biscuit, that might be enough to be able to cause a toxicity. But these chocolate calculators are freely available for owners to use as well. So, you don't have to call your vet. So you can, look at the chocolate toxicity calculator online. But I think as long as you're sensible in these situations and make sure you seek some sort of advice, if unsure, then, in most of these situations, we can act quickly.
Yeah. Okay. All right. So let's not get too excited if you drop a bit of biscuit on the floor and your dog eats it. Now, if you are unlucky and you have a chocolate stash, and your dog manages to eat 500 grams of milk chocolate or something like that, which is an awful lot of chocolate. People don't see this amount of chocolate normally, so you've got to just get it in your head what a massive slab of chocolate that is. You mentioned it a little bit before, but what kind of symptoms might happen if your dog, does have a good chocolate gorge?
Absolutely. So, I think symptoms do take a little bit of time to develop with chocolate toxicity. So if a dog eats an extortionate amount all in one, we might see them vomit it up because it's a lot of sugar for their bodies to cope with. So vomiting, drooling, hypersalivating can be.
So vomiting in that case is probably a good thing. Get it out of the body.
Yes, exactly. Yeah. So no, it is a good thing if dogs do vomit it up. It means that it, like you say, it clears it from their body. The trouble is with vomiting, the stomach can only sometimes empty by 60%, so there can still be bits left behind even if a dog does vomit. And then, if the chocolate is absorbed in high enough quantities, it causes neurological toxicity, actually. So you see signs of the neurological system like collapse, you can see tremors and even seizures sometimes. And I think the risk is with seizures, if a dog does seize for more than 5 minutes, it causes a lack of blood flow to the brain. With the muscles seizing like that, it can cause a really severe increase in temperature and actually lead to severe brain damage.
Okay. Now, if someone is unfortunate enough for their dog to scarf a load of chocolate and looks ill, and you take the dog to the vet, what does the vet actually do?
So what we do, so we weigh the animal, see how much they weigh, and obviously if it hasn't been done already, we check to see if a toxic dose has been eaten, as to whether the clinical signs are likely related or not. What we then do, as long as it's safe, so as long as the animal is awake and able to vomit. So for example, if an animal is in a seizure or collapsed, we won't make them vomit, because there is a risk of them inhaling their vomit, as with humans. So we give them a drug, just a little injection under the skin on the back of their neck, with a drug called apomorphine, which then makes them vomit very reliably with dogs. So within 5-10 minutes they vomit. Like I said, the stomach does sometimes only empty by 60% with vomiting. So we normally do see a good quantity brought up. And the rainbow of vomits I've seen over the years is amazing, with wrappers and content. Once they've stopped being sick, and I normally let the drug sort of run its own course, so that if they are going to be sick 20 minutes later, we make sure that everything's out their system. And then once they're sort of safe, we'll check them over. We'll make sure that there are no signs of toxicity, for example, in these cases where they have just eaten something and no signs have developed. If the dog is unwell, however, in some of these cases, making them sick isn't safe. So actually supportive care is the most important thing then. So monitoring for neurological toxicity, managing any clinical signs that do develop. And I think those are the sorts of cases where the risk of death is higher, because they have the toxins in their system, regardless of what we do, because it just isn't safe to make them sick.
Right. So, I mean, how many times as a practicing vet have you come across something like this? Is it a daily occurrence for a typical vet, or once a year, or?
So making animals sick, prevalent around the Easter and the Christmas seasons. So Easter with chocolate and hot cross buns, Christmas with, again, chocolate and Christmas cake, mince pies. As well as chocolate, we also know that there's toxicity associated with raisins and grapes. So, making dogs vomit is a very, very regular occurrence around this time of year. I'd say, we have a few cases in a week of dogs that need to be made to be sick. And I think it's commonly around these periods when owners go away as well, and sometimes do leave their dogs in the possession of friends or family, or a dog carer who might not know their habits of raiding cupboards and bins quite so much. So we often see them coming in with carers rather than the owners themselves. And obviously we need to then speak to the owners to gain permission to give any treatment in those scenarios, which can prove challenging if they're on holiday. I think really with actual toxicities, because owners and carers are quite astute, the majority of these cases we see brought in are prior to any toxicity developing, so we can safely make them sick. I think more of these toxicity things occur when, animals are left alone for very long periods of time, and, the owner or carer comes home and the dog is just simply unwell. And in those scenarios, we don't sometimes know that it is because of a toxicity, and we have to kind of, really delve into the history to find out why this animal is so unwell.
Okay. On the foods, you kind of touched on it a little bit earlier. Some things other than chocolate that we need to be careful about if our dogs might eat them. What, can you just go through those again?
Yeah, of course. So chocolate's a big one, obviously. Grapes and raisins are a big thing at the moment, because we are still only now discovering what the toxic component of these is. As well as how much causes a toxicity. So both grapes and raisins have something called tartaric acid present within them, and this, to some animals that ingest it, who can't process this, can be poisonous. So we do need to be very careful with any kind of ingestion. And I suppose it brings us back to the chocolates. A dog might eat 200 grams of chocolate and it not be a toxic dose, but actually if that chocolate's a fruit and nut bar and contains raisins or contains macadamia nuts, which are also toxic, we often need to make them sick and treat them at much lower levels of chocolate toxicity. I think another big one around this time of year is
any general guidelines for, I don't know, most households probably have some raisins around. So if your dog finds the raisins, are there any general guidelines as to amount of raisins? Because I'm sure 1 or 2 raisins isn't going to harm most dogs, but how many, what weight?
I think anything more than 1 raisin or grape, I think needs veterinary intervention, because it does have the potential to cause toxicity. And like we said, we're still discovering why these foods are toxic to animals. So, we need to be extra cautious in these situations. Hopefully, in a few years' time, we'll have like a grape and a raisin calculator to know, if your animal has eaten these, how much is going to cause toxicity. But we do need to be much more careful with grapes and raisins. And grapes and raisins cause renal failure. So, the side effects of them can be very severe and cause either death or, life-altering changes with animals. So we do need to be careful.
This really is a problem. This isn't just a case of vets making us all terrified to drum up a bit of business.
No. I mean, vets don't work like that. We want what's best for the animals at hand and want to make sure that, there are any unavoidable, toxicities by making them sick. So, we never want to make an animal sick if it's avoidable. So, the reason we do it is because of these severe cases that have been found. Right. So there's rhyme and reason behind it all.
One specific thing, let me ask about, and I don't know if this is something to be worried about or not, but a lot of dogs, including my dog, do have this revolting habit of eating their own vomit, which I've seen her do a couple of times.
Yeah.
What could possibly lead to that? And is that indicative of some issue that I should be worried about?
Not at all. I think it's such common things for animals to eat their own vomit. I think particularly if they've just eaten their meal and then they vomit it back up again, all they see that vomit as is just a bit of digested food, so they will eat it again. I think the trouble comes when you're purposely making an animal sick, like they've eaten chocolate or something, and then they are sick, and then they think, oh, that looks tasty, what I've just brought up, and trying to wrestle with them to stop them from eating it again can be a bit challenging in clinic.
So I've got an even worse question. My dog doesn't have this habit, but one of her friends at the park does. Will scavenge around to try and eat poo.
Yeah,
most people are very good and pick up the poo, but occasionally the dog will find some poo and eat it. Is that a problem?
Yeah. So it can be a problem. I think, it's unknown as to whether the poo that they're eating contains parasites, worms, any sort of other drug components. If a dog is on medication, a lot of the metabolites come out through their poo, and potentially eating another animal's poo can cause a problem. I think also it can cause vomiting and diarrhea, and like you say, it can be an indication that they're lacking something in their diet. Sometimes dogs do eat other poo. As something called pica, which is where they, are lacking some sort of mineral or vitamin in their diet, and they eat poo or other sort of objects as a mechanism to try and supplement themselves with it. I think largely the reason that animals do eat poo is, again, they just find it tasty. Animals are very, very disgusting. I think, a lot of dogs really enjoy cat poo. And that is something I know from owners, they're always telling me that they're raiding the cat litter tray. And I think it is just because they find it tasty.
Goodness me. Why do we love these animals so much?
I know. I ask myself that question commonly with mine.
Okay, right. So look, we have touched on some really quite important stuff here as far as dogs finding hoards of chocolate and scoffing a lot and other things as well. If people, well, I suppose 2 questions really. if you do come across your dog and an empty box of chocolates, and the suspicion is your dog's just eaten the whole lot, what do you do then? The next thing you do, and also if people want some information in general about keeping dogs and other pets happy and healthy, what's a good resource?
Absolutely. So, I was in this position myself last year when my dog ate a tulip bulb in the springtime. And, tulips and spring bulbs, as well as chocolate and things, they can be toxic to dogs. And, spring bulbs can cause toxicity to the heart. So I immediately took her into my work, and she had a full physical examination to check her heart and her lungs. And we made her sick pretty quickly. So she brought up any of the bits that she'd chewed up. So I think, the most important thing is seek advice, even if that's just calling your vets to make sure that, what they've eaten is or isn't toxic and what action is needed. And I think, making sure that your pet is registered with the vet is really important as well, so that, you know that you can be seen by them in an emergency and the problem at hand could be focused on rather than having to register. I think with regard to getting more information, there are loads of articles on the Every Paw pet healthcare website that talk about toxicities in animals, all of the different ones, as well as a whole host of other topics. There's other important things this time of year, like with the weather getting warmer, about keeping your pets cool in the summer months. So, online, there's some really great resources for information.
Excellent. All right. Look, all this is very good advice. So, Anna, thank you very much indeed for taking the time to chat.
No problem at all. Very welcome.
Thank you very much to my guests on this week's show. Thank you to you for listening, and have a healthy week. Until next week.
Thanks for listening to the Relax Back UK show. Join me, Mike Dilk, again next week for more fascinating interviews and chat. If you're listening to the podcast version, please subscribe, like, and share it with your family and friends. And have a healthy week. Until next week.